diabetes mellitus, it is a metabolic, chronic metabolic disorder, which is due to the either defective insulin secretion or action or both. And this is basically related to disorders in carbohydrate, lipid, or protein metabolism. Today we'll be picking up the first, that is the carbohydrate metabolic defect in diabetes mellitus. Let's begin with this case scenario in which a 40-year-old male patient is newly diagnosed with type 2 diabetes mellitus. Depending upon the following reports, his fasting blood sugar level was found to be 190 milligram per deciliter. Post-meal blood sugar was 320 milligram per deciliter. His glycosylated hemoglobin was 9.6% of hemoglobin. Now, this patient is obese and he has sedentary lifestyle. He is advised dietary modifications and physical exercises as of now. And he's also started on glycemic SR 500 milligrams BD. Next slide, please. So just beginning with the question answer round for today, taking into consideration this newly diagnosed diabetes mellitus patient, because we really want to focus on what exact metabolic defect is occurring in this patient. So let us begin with question 1 today. Okay. So my first question to all of you is, what is the cause of raised fasting blood sugar in this patient? Is it due to increased glycogenesis, increased glycolysis, increased gluconeogenesis, or is it decreased glycogenolysis?
Please write all your answers on the chat box. We'll be taking the question answers from there. So Dr. Himanshi has written B. Increased glycolysis.
Okay. It's okay if you are typing wrong answer. It's absolutely fine. Whatever concepts you have related to carbohydrate metabolic.
Dr. Rahul and Dr. Gaurav has written option C, increased glucogenesis. And Dr. Gautam has also mentioned option C. Dr. Rutika has mentioned B. And Dr. Ayusha has mentioned B option, and Dr. Pavan B, C. So basically we have maximum B and C option. Dr. Zahir has also mentioned option C. So maximum is C and B, doctor.
Fine. Any more answers?
Dr. Vikas has option B. Dr. Aisha has also mentioned option B. So the maximum answer is increased glycolysis. And there are few who have decided to go for the option C, that is increased glucogenesis.
Okay, so this is first question regarding the fasting blood sugar, because we really want to clear our concepts why the fasting or the post-meal blood sugar levels are getting raised in typically in diabetic patients. So my second question goes, can we have the next slide, please? My second question is, what is the cause of raised post-meal blood sugar in this patient? Is it due to decreased glycogenesis or decreased glycogenolysis or increased glycolysis, or is it none of the above? So let me have answers from your end so that I further explain you in detail what is the exact reason of raised fasting as well as post-meal blood glucose levels.
Dr. Rahul has mentioned option B.
More answers are please welcome.
Dr. Aisha has written option A. Dr. Zahir has also mentioned option A. Dr. Himanshi has also mentioned option A. And Dr. Pavan has also mentioned option A. Dr. Ayusha has also mentioned option A. So the maximum answer is option A.
Okay.
Dr. Gaurav has also mentioned option A.
Any more answers or we
No,
can move
ma'am.
to next slide?
Next slide.
Yes. So let's begin our explanation part. Before we can understand what exactly metabolic pathway is taking place in a type 2 diabetic patient, we must understand what normal pathways are taking place in a normal person first. So basically what is happening in our body can be explained with the help of this diagram. On the left, you can see low blood glucose, which typically occurs when we are in a fasting state or we have not eaten anything for long. On the right, you can see what happens when there is high blood glucose in the body, rather after meals or we are in a well-fed stage. So first of all, I am going to explain you the left half of the diagram. When our body have low blood glucose level, so we have not eating anything for long or we are starving, so in such cases our brain, it stimulates the organ pancreas. So pancreas, as you must be knowing, have two types of cells, that is alpha cells and the beta cells. When the body is in a state of low blood glucose level, this brain, it stimulates the pancreas to typically the alpha cells of the pancreas to secrete the hormone glucagon. You all must be knowing glucagon is otherwise called as a hyperglycemic hormone. Why this pancreas is getting stimulated? Because in the end we want a normal glucose homeostasis in the body. Once this glucagon is released by the alpha cells of the pancreas, this glucagon, it in turn stimulates the liver. Now, why it is stimulating liver? Because it wants to raise the blood glucose level so that it can maintain that normal blood glucose levels in the body. So this glucagon, it is stimulating liver to achieve this normal blood glucose level. So exactly in liver, it is stimulating two important carbohydrate pathways. This is nothing but the gluconeogenesis and the glycogenolysis. In short, I would like to explain you, but I want to explain both of these cycles in details in the coming slides. Basically, whatever glycogen is stored in the liver in the form of energy, it is being broken down into glucose, which is called as glycogenolysis. And the second cycle that is stimulated by glucagon, I told you, that is gluconeogenesis, whereas again glucose is being formed in the body by other non-carbohydrate precursors that is present in the body. Okay, so that is how this glucagon is coming into action when our body is experiencing low blood glucose levels. In contrast, let's cover the right part. What is happening when we have high blood glucose level? Now we are in a well-fed state. Okay, we have had our meal. We are in a well-fed state. So we can even enter into hyperglycemia. This I'm typically explaining in normal subjects. So when we are in a well-fed stage, also this pancreas is been again activated. Now, after activation, these beta cells of the pancreas, this typically secretes the hormone insulin. You all must be knowing. So this insulin, once it is released by the beta cells of the pancreas, I repeat, this is happening in when our body is having high blood glucose levels. So normally, beta cells of the pancreas is secreting insulin, and this insulin in turn, its main function is whatever glucose is running high in our blood, it has to be uptaken. So insulin basically takes part of the glucose uptake in the body. Now, where this uptake will take place? It will take place in the peripheral tissues and the adipose tissue of the body. So ultimately, what insulin is doing, it is converting the high blood glucose into low blood glucose, and finally it will also achieve the normal blood glucose levels. So this glucagon is a hyperglycemic hormone, insulin is a hypoglycemic hormone. So these are having opposite actions. And why I need to explain this is because first we must be knowing what normally is happening in our body. Okay, so this we have seen what is happening in the empty stomach state and what is happening in the well-fed state. Any questions on this is welcome at this stage, so that it will be easier for you to understand the pathways ahead. Can we have the previous slide, Ritika? If anybody has any questions. I hope this much part is clear.
Any questions related to this cycle? Please write it on the chat box. Doctor, there are no questions.
Okay, let's move to the next slide. Next slide, please. Now the exact thing what I have explained, what is exactly happening in a normal person with respect to two important hormones, that are the insulin and the glucagon. From this simple diagram, I want to explain what exactly are the carbohydrate pathways these cycles are, these hormones are stimulating or inhibiting. So this is very important to know. Let's see the first above part of this diagram. As you can see, I've already explained what is happening when our body is having low blood glucose levels. It is stimulating the pancreatic alpha cells to secrete the glucagon. Now, as we say, when the body is having low glucose, this glucagon acts as hyperglycemic hormone and it increases the blood glucose levels. But what exactly, by which pathways it is increasing this blood glucose levels? It stimulates two important cycles, as I've already mentioned. First is the gluconeogenesis, in which glucose is synthesized from non-carbohydrate precursors in the body. This can be pyruvate, this can be acetyl-CoA, this can be fatty acids. Or the second cycle which this glucagon is stimulating is the glycogenolysis. Glycogenolysis, as in the breakdown of the stored glycogen into the glucose. This is how exactly the hyperglycemic hormone glucagon is increasing the blood glucose levels in fasting state. Now let's see the second half of this diagram. What is happening when there is high blood glucose levels, when we are in a well-fed state? Again, the pancreatic, now the beta cells are being stimulated and it secretes the hormone insulin. Insulin is otherwise also called as a hypoglycemic hormone. Okay, so what exactly this insulin is doing? In two words, I've explained, its main function is just glucose uptake in the body. So what it is acting at the level of liver is it is stimulating glycogenesis. So what is glycogenesis? Is the formation of glycogen from glucose. Secondly, what it is doing in skeletal muscle and adipose tissue is it is stimulating another two important cycles. One, glycogenesis, as I've already explained. And second is the glucose transport into the adipose tissue and skeletal muscle. Now, this glucose transport can be in the form of another important cycle, which is also called as glycolysis. Glycogenesis is conversion of glucose into glycogen, and glycolysis is the conversion of glucose into pyruvic acid. So as I have already mentioned, insulin's main function is glucose uptake. So glucose is getting converted into glycogen and pyruvic acid like compounds. And in this way, it causes the blood glucose levels to fall because now these are being uptaken by the peripheral tissues and the adipose tissue and the skeletal muscle. So in the same diagram, I don't want to explain you what exactly it is inhibiting. As it is seen in the minus forms, this might be confusing. So just to revise this slide, glucagon is increasing our blood sugar levels by stimulating gluconeogenesis and glycogenolysis. And insulin is reducing our blood glucose levels by stimulating glycogenesis and glycolysis. From this diagram, most importantly, as I've already mentioned, we are comparing the normal subjects and the diabetic patients. So what do you think, what will be happening exactly in case of diabetic person? So your answer is hidden in the lower second part of the slide, where we say ki insulin, Ritika, it will be helpful if you use the pointer when I am explaining things, because I cannot do it from my end. I want to clear the diabetic part from this end, from this diagram, the lower part, please. So this diagram I have explained you when it comes to normal person. What is happening in diabetic person is insulin secretion. Can you see the insulin secretion on the lower part, that circle? So as we say, either the insulin secretion is defective or the insulin action is defective, or both. If we typically see in type 2 diabetes mellitus, there is nothing to do with secretion because insulin is getting secreted normally, right? So insulin action is defective, as in the insulin action is not proper. So its main function, which is the glucose uptake. So this glucose transport, when we say, it is from the blood to the peripheral tissues, to the skeletal muscles and the adipose tissue. This is the main defect. So what is happening कि जो इंसुलिन का नॉर्मल फंक्शन है कि ग्लूकोज को ट्रांसपोर्ट करना है ब्लड से इन पेरिफेरल टिश्यूज का, वो हो नहीं पा रहा है. क्यों? बिकॉज डायबिटिक्स में इंसुलिन एक्शन इज डिफेक्टिव, राइट? तो यदि ये हो नहीं पा रहा है तो isn't it obvious कि ब्लड में ग्लूकोज के लेवल्स विल इंक्रीज. And why this is happening is, as we have already seen, insulin is otherwise called as an anabolic hormone. So it supports two important cycles, that is the glycogenesis and the glycolysis. तो अब ग्लूकोज का कन्वर्शन ना ग्लाइकोजन में होने वाला है ना पायरुविक एसिड में. And what is the crux is the glucose, we will have high blood glucose levels as typically seen in type 2 diabetes mellitus patients. So here, whatever defect is being taken place is very well explained in this diagram, ki why in type 2 diabetes mellitus there is high blood sugar levels. So this is the exact carbohydrate metabolic pathways. These 4 cycles are playing very, very important role when it comes to type 2 diabetes mellitus. Let me repeat once again. It is gluconeogenesis, it is glycogenolysis, it is glycolysis, and it is glycogenesis. Can we move to the next slide, please? Now let me come to the first question again. So now that your concepts are cleared, can I have the right answer, please? Like, what is the cause of raised fasting blood sugar in this patient? So fasting state में normally क्या हो रहा है जो because of insulin action defect अभी नहीं होगा?
Please select your answer. So we have option C by Dr. Himanshi and Prabita.
I'm very happy to see the right answers are pouring now. And I can see all the right answers. As of the 5 answers, I can see all are
Option
indicating
C.
C.
Yes, doctor. Okay. So now all the options are option C.
Okay, so it feels good that I was clear in my part to explain. And the correct answer is, yeah, increased gluconeogenesis